If you have a loved one with special needs, this video is for you. I want to walk you through everything you need to know about special needs trust, what they are, how they work, what they cover, and how to set one up the right way. I'm Kim Clenney, an attorney here in Montgomery, Alabama, and my law partner, Deborah Palmer, and I work with families across Alabama on special needs planning. This is one of the most important conversations a family can have, and I want to make sure you leave this video with a clear picture of where to start. A special needs trust is a legal structure designed to hold assets for a person with a disability without disqualifying them for government benefits like SSI or Medicaid. Those programs have strict asset limits. If your loved one has too much money in their name, they lose their benefits. A special needs trust solves that problem by holding the asset separately in a way the government does not count. A lot of families don't find this out until it's too late. They leave money in a will. A well-meaning relative writes a check, or an inheritance comes through unexpectedly, and suddenly their loved one is over the asset limit and their benefits are at risk. Special needs trust prevents all of that. There are two main types of special needs trust, and which one your family needs depends entirely on your situation. Getting that wrong has real consequences, so that conversation is worth having with an attorney before you move forward. Now, let's talk about what the trust can actually pay for, because this is where families are often surprised. The trust is meant to supplement government benefits, covering things SSI and Medicaid don't. These include transportation, vehicle, vacations, and travel and entertainment, electronics, clothing, personal care, education, physical therapy, beyond what insurance covers, anything that improves quality of life and isn't already being covered by benefits. What the trust cannot do is pay for basic food and shelter in a way that overlaps with what SSI already provides, because that can reduce the monthly benefit amount. The line between what's allowed and what triggers a reduction is something your attorney needs to get right when the trust is drafted. Now let's talk about the trustee, because this is one of the most overlooked decisions families make. The trustee manages the trust, handles distributions, keeps records, and makes sure every transaction stays within the rules. Good intentions are not enough here. A trustee who doesn't understand benefit eligibility rules can accidentally make distributions that cost your loved ones their SSI or Medicaid. Some families name a sibling or close relative. Others choose a professional trustee or split the role between family member and professional who handles the financial side. There's no single right answer, but this decision deserves real thought and should be part of the conversation when you're setting the trust up. The last thing I want to say is about timing. The time to set up a special needs trust is before you need it, before an inheritance comes through, before your estate plan is finalized, before something unexpected happens. A trust that isn't in place can't protect anyone. If you want to make sure your loved one is protected without losing the benefits they depend on, we're offering a free 30-minute special needs trust consultation. Book the link below, and I'll talk to you soon.